The nursing implications for the patient receiving regional anesthesia. Welcome. My name is Emily DeBusk, and I'm excited to be here with you today to introduce to you the concept of block nursing, and a specialty that I'm extremely passionate about. I look forward to taking some time to explain to you the duties that are involved in this nursing role, as well as some of the opportunities we have to expand this role within our nursing profession. A little bit about my journey to you today. I graduated from Elon University with a degree in psychology and sociology. Knowing that I wanted to help people, I went on to the Watts School of Nursing. It is there that I truly discovered my passion as being a clinical bedside nurse. At Duke University, I had the opportunity to work along fabulous regional anesthesia professionals. It was there that I worked with a great team in developing and recognizing the role for a specialized nurse to take care of patients who would be receiving regional anesthesia. It was there that my passion truly came alive, and I discovered that what I wanted to do was help implement these teams and this role to not only hospitals in North Carolina, but nationwide, anywhere that had patients that could benefit from regional anesthesia. I then traveled over to Rex to help develop and continue to increase regional anesthesia and blocks there, while teaching and traveling and lecturing on block nursing. The Block Nurse Team Purpose Statement, this slide kind of goes against our PowerPoint rules of a lot of words on one screen, but some of the things I like to pull out here is that this is a breakthrough role in the perioperative setting. It is a challenging role. Anything that's new and expanding is always going to take a lot of dedication to get up and going. But some of the things that we pull out are nurses that are compassionate, skills that involve critical thinking, true advocacy for the patients, and strong procedural performance. Those are all things that not only the block nurse team should have, but also the block nurse as an individual as well. Having all of these things, we have come to realize, makes not only block nursing a part of the patient's care team, but an irreplaceable part. Completing the continuum of care. I tell everyone, when people ask, what is the role of the block nurse? I said the block nurse truly does complete the patient's care team. You can't laugh at my drawing here on the PowerPoint when someone had asked me, the very first year when we were really spreading what block nursing was, to just sketch out what my vision was. So this is an original sketch of what I envision the block nurse's role to be. And as you can see here, it involves the patient front and center. It involves the surgeon, anesthesia team, administration, and then the block nurse. And I envision the block nurse as kind of the coordinator of all of these team members. And it says, only together can we develop this team and role. And it is so true. As we've seen this role emerge in different communities, healthcare settings, we really have realized that only through the support of everyone involved does this role truly develop. And that's when you see a truly successful team. Regional anesthesia blocks make sense. A funny slide here, we show Tio here, who was a patient recently down at the Andrews Institute. We said, his show is the Tio show, Tio knows best. So if he's choosing regional anesthesia, then that means that everyone should choose regional anesthesia. But in all seriousness, it truly is the best care and the best pain control that a patient can have. We talk about it making sense not only to hospital settings in terms of efficiency and patient satisfaction, but we talk what's most important, and again, if we go back to the center of that heart in the previous slide, and that's the patient. And what we really want, and what is our goal as nurses, and what makes us feel like we're making a difference, is to be able to provide superior pain control to our patients, avoiding general anesthesia, nausea, all the side effects that come from having to have surgery. As block nurses, we like to think that if we're able to offer regional anesthesia, help facilitate it, introduce it to the patient in some way, and that way we're actually able to change the patient's surgical perspective. And we also talk about there why it makes sense to the block nurse. And again, from a nursing perspective, we see the patients who have blocks. These are the patients that are in PACU for shorter amounts of time. They don't need as many narcotics. They get to see their families sooner. All of those things that as a nurse taking care of these patients are important to us. Learning objectives. A lot of learning objectives here, and again, we're not going to go through all of them, especially in this brief introduction, but I'll take an opportunity in this slide just to tell you that there is a textbook that accompanies the course that we're going to be talking about a little bit later on. It goes through all of these objectives, and in the textbook you talk about, it introduces the role and then goes step by step through what the nurse would need to set up and help facilitate a successful regional anesthesia program. We look at the nursing process from assessment of these patients to educating these patients, room setup, equipment function, and then actually getting these patients out the door and home and helping them feel comfortable going home with their blocks in a safe manner. All of these things are addressed in step-by-step, nursing-friendly textbook that accompanies the course and the certification for block nursing. The benefits of the block nurse. This is one of my favorite slides. We see Dr. Hickman here, and this is not one of the patients that he's performed a nerve block on, luckily. This is actually us at a photo shoot working on some pictures for the textbook. And it kind of lets me jump right down to that surprise job satisfaction and the benefits of the block nurse. It's one of the things when we started to see this role emerge was a surprise for us, because we knew, as working in this role, that we were seeing patient safety increase. We were preventing wrong-sided blocks. We were educating the patient, so we were reducing falls. We knew the patients were happier because they weren't having pain. We could see our on-time starts improving and the efficiency in our ORs. We could see all of those things. But job satisfaction was really cool because you saw care team members come together, smiling at work, laughing at work, happy to be at work. And again, if there's less stress involved, if there's less chaos, if there's an organized system in place, everyone is happier. The patients are happy, surgeons are happy, they're getting their patients on time, nurses are happy, and then you see anesthesia happy as well. So here's us having a good time at work on the job. Luckily not performing any sort of ACLS moves on this patient for real. The block nurse and patient safety, one of the biggest things when people ask, why implement a block nursing program? This is the #1 response. Block nurse and patient safety, there's numerous things, again, all addressed in the textbook and course that can correspond with how the nurse actually contributes to safety regarding to regional anesthesia. However, timeout procedure is the very first one, and one of the ones that if you take nothing else from the lecture, it's important to go home with the timeout procedure, and not only a timeout, but a block nurse initiated timeout. Going back to the continuum of care, the block nurse is assessing these patients, checking the patients in the holding room, and they know everything about the patient. So when the nurse is at the bedside initiating the timeout, she's there actually to say in confidence that she knows this patient, she knows that it's the right side or the left side, whichever side is being done, and she's there with anesthesia right before the procedure starts. It outlines some guidelines in terms of what actually should take place in the text, again, for a correctly initiated block nurse timeout. The second thing that we touch on here, and again, just one of those main things, take home, if there's 2 take-home things, timeouts and lipid rescue. And lipid rescue is the only way, rare complication of regional anesthesia and blocks, but lipid rescue is a must-have in your block carts. And not only is it a must-have, but you must have someone who knows how to correctly administer it and knows where it is. Time is so important if you're in a situation where you're having to administer lipids. No time to have to gather correct size syringes and ask someone how to use it and get it out of the Pyxis. This is something that the nurse must have organized at the bedside or in the block cart and know how to administer it if that situation would arise. The happy patient. We talk about patient satisfaction, and again, it's not for nurses who work with patients who have blocks all the time, it's not uncommon to see this patient who I picture here on this slide, a patient looking like that, roll out from the operating room. These patients truly do wake up smiling, and it's a great thing. And you only need to recover one patient who's opted for a block and then an hour later recover the patient from the same surgeon who's not opted for the block to truly see the benefit and what it makes in the patient's recovery and actually, again, going back to their surgical experience. We also talk about patient satisfaction in terms of how it benefits facilities. and we look at those scores that are so important in terms of running successful and profitable surgery centers and hospitals. And you know that if you have a patient who's had a good experience, that's either what brings them back to that same facility, or that's what they tell their neighbors. And they say, hey, you know what? I had surgery at so-and-so, had a block, came home, felt great. And we hear it all the time. Either same patients coming back and said, I had my knee done here, I wasn't having it done anywhere else because I was able to have a block. Or you see the patients who have recommended their friends and family to come because they know that they're going to get superior pain control after their surgery. Getting started efficiently, again, the third benefit that we talked about earlier regarding the benefits of a block nurse role. Two ways to look at it here. Efficiency in regards to the nurse, an educated nurse being able to set up the rooms, have the room ready. When you're doing, 20 cases a day and you're able to, quick turnover and everyone wants everything at once. Being able to have everything organized, know what supplies you want. Have a nurse who's dedicated there is where you're going to see that efficiency really be able to increase in your hospital settings. Also having, again, just we picture here the tray with everything set up. That's really how the nurse can be able to facilitate blocks. And here again we talk about, one of the biggest things we hear, I don't want my patient to have a block because it's going to slow down the OR. It's going to be too much time. It's actually not, and frankly, it's the exact opposite. It's not a reason that a patient should not receive the best pain control, and truly, the nurse can actually increase the efficiency. We have data that was submitted in 2011 to the American Society of Regional Anesthesia as well as the American Society of Peri-Anesthesia Nursing that states that we were actually hitting our turnover goal times over 20%. We were hitting that more on time than we had been previously with more patients receiving blocks. Need to knows, again, if you're trying to do something efficiently, this is just some of the knowledge, basic knowledge that the nurses need to know. Coming to the course where you can actually have the hands-on experience. At the Block Nursing Workshop, we work with case studies and hands-on experience to actually work with the nerve stimulator, know the buttons, know the functions, work with the ultrasound, know how to adjust the gain and depth, and all of those things that if you don't know, frankly, it could slow down a process. But having a nurse who's been certified and knows how to work both of these pieces of equipment will really help increase the efficiency in a practice. As well as both of these pieces of equipment are not only pretty much standards of care for blocks in regional anesthesia, but again, increased safety in terms of these, helping identify where nerves are, and then actually helping identify where not to place needles as well. Dual guidance, and again, it just talks about what we just spoke about, nerve stimulator, ultrasound, and the combination of both, and really what a benefit it is in terms of patient safety, and again, making sure you have a block that's going to work for the patient, whether it be for primary anesthetic or for postoperative pain relief. Local anesthetics and additives, another thing that we address at the course in depth, going back to your educated nurse, your knowledgeable block nurse who's going to know what these medications are and how long they last and how they can benefit the patient's care, and frankly to help choose which one may be better. Again, your nurse is the patient. Your nurse is checking in the patient. She knows the length of the case. She knows comorbidities of the patient, whether it's going to be, you're going to need a local anesthetic that's going to set up faster as to use it for primary anesthetic, or really to know that this is a chronic pain patient. So the longer that we can keep this block in place, the better, and anything that we can do to help facilitate this. Block nursing and the nursing process. I tell everyone that if you had told me in nursing school that I was going to be doing anything that touched on the nursing process, I would have told them they were absolutely crazy. However, when I sat down to write the curriculum for block nursing, it truly is the foundation of nursing, and it makes sense to go through things this way. As nurses, we assess, we diagnose, we plan, we implement, and evaluate constantly, probably 3,000 times a day in a shift without even knowing that we're doing it. But pulling the steps of the nursing process out like this and applying them to regional anesthesia really helps you see the value of this role. whether it's the preoperative assessment for whether they are able to have a block, for, again, comorbidities, coagulation status, all of those things, then help you diagnose what block is appropriate for the patient. Planning, grabbing all your stuff together, setting up the room, and then actually being the patient advocate at the bedside to help implement that block. Being there, monitoring the patient, comforting the patient, just letting them know that someone's there. And then the final step is to evaluate the patient. See them in PACU. Make sure that the plan that you've put together is actually working. And then follow up with them, whether it be up on the floor or at home later on. In the bottom is one of my favorite quotes. It says, "Unless we are making progress in our nursing profession every year, every month, every week, take my word for it, we are going back." And it's so true, and that's one of the exceptional things that we're seeing about this specialty as it develops. Upper extremity blocks, again, we're just going to touch on some of the things that we're going to focus on looking forward to, looking at the block nursing course. There's a whole lecture dedicated to upper extremity blocks where we touch on some anatomy, anatomy that not just your everyday nurse would know, but knowledge that the block nurse should know. We look at the interscaling block for your shoulders. We look at supraclavicular block for the surgery of your arms. Infraclavicular block and why you may choose that block over a supraclavicular block and how the block nurse can advocate for that in her setting. And then the axillary block, and again, why that may be optimal for whatever the patient is having done. All things that after coming to the course, hearing the lectures, you're then going to be able to take that knowledge and go right into the nursing considerations. And right there, that transition of having the knowledge and then applying it to the nursing considerations for the block is, again, key in completing that patient care team and making sure that that patient's receiving the best care. We look at things just as simple as patient positioning to make sure they're comfortable. We look at education on things such as phrenic block, Horner syndrome, even just preparing them, knowing that these are complications, side effects that they may have, but that they're normal and that they'll go away, and so that they know when they wake up that that's okay. We look at hot and cold, teaching about going home with a numb arm or an upper extremity, and then sling care. All of those things that the nurse knows because of her education and her certification as a block nurse. We do the same here for lower extremity blocks. Again, at the course, you'll receive an in-depth lecture looking at the anatomy of lower extremity and then looking at what blocks apply and for what surgeries. The femoral block, our sciatic blocks, saphenous block and ankle block are all of the ones that we really look at and touch on in terms of, for your patients, your total knees, your ankle surgery, all of the blocks that are going to help give better pain control for your lower extremity surgeries. And again, being able to take that knowledge and parlay it into our nursing care. Here we again see the nurse educating the patient. Huge, huge, huge in terms of fall risk. These patients need the education of a block nurse. They need the special assessment and care that this patient needs. The quickest thing to destroy a regional anesthesia program is to have a patient fall who's had a block. And it just does not happen when you have the nurses talking to them, educating the patient, giving them proper teaching, not only preoperatively, but postoperatively with their patients as well. And again, here we see our medication bottle, and again, just touch on the decrease in narcotics that these patients have so that they are able to get on their crutches and get out the door quicker. Procedural importance, we touched on it when we talked about the block nurse and the purpose statement. And again, it just talks about how strong procedural performance really is a crucial, crucial part of this role. Whether it be your skills of ACLS and PALS and having that knowledge at the bedside, or skills specific to block nursing. Here we just give an example, again, of what is this is pulled out from the textbook in terms of some of the things that we touch on in the block nursing curriculum and the education that they receive at our certification courses. We look at injection techniques. And here it seems simple. Oh, grab someone, have them inject a syringe, and it's just not that simple. And actually here is, again, tidbits of knowledge making a big difference. Correct syringe sizes, aspirating before injecting, injection pressure are all things that can affect the nurse is able to communicate to the anesthesiologist, thus affecting the block quality as well as the safety of the block, making sure that you're in the right place, that you're not intraneural, that you're not intravascular. So again, something that seems simple, you know, grabbing syringes and needles really can make a huge difference in the patient care and the patient's block experience. Quick tips, block room procedure. One of the favorite things about the block nursing textbook that you'll receive at the course is some of the pages that are like this. Again, very nursing friendly, and in terms of having a usable book, having a usable curriculum that you can have at the bedside to check off kind of what you're doing when you're in a rush, when you have 3 patients to get ready in 10 minutes. This is the stuff that comes in handy. And again, just going through and making sure, you know, you have you've assessed your patient, you know the patient's history, you've educated the patient, you have your paperwork in place, emergency air room equipment, sedation, your nerve block supplies, monitors, timeout. Again, we go to the very important timeout procedure. You know, no block should ever start without that nurse-initiated timeout. It's, you know, 5 seconds that, although sometimes can be annoying to gather everyone together, can save, you know, tons and tons of headache if anything were to go wrong, if not done correctly. And then again, the monitoring of the patient until they're taken to the OR. The future of block nursing is very, very, very exciting. Again, looking at this specialty develop as we go forward. We are going to be offering block nursing courses. It will be 11 CEU credited course. It comes with the complete textbook, and we'll go through lectures, again, anatomy, nursing considerations. We have panel discussion with block nurses who are functioning in this role across the country, and then we'll go into actual half-day hands-on case studies, scanning, gathering supplies, using the ultrasounds, looking at the nerve stimulator, really making us confident that when a nurse leaves our course, they're able to go home and make a difference in their facilities as a block nurse. We're excited to be working on the certification of it. At the end of the course, Block Nursing is offering a certification. We feel comfortable and confident that at the end of our course, again, you will have the skills necessary to go home and be able to complete everything within the job description of a block nurse. And research and development. And as this group and this team of nurses is expanding across the country, we've seen more and more collaboration in terms of, again, looking at the research, compiling the research, and having, you know, we've known it as nurses, but really having the hard data to show that this role is making a difference in terms of preventing wrong-sided blocks, increasing efficiency, and making our patients happier. And that's really, truly what it's all about. Just having the opportunity to make a difference in our patients' lives. So I thank you for giving me the opportunity to introduce to you the concept of block nursing, and I hope to see you at one of our courses soon. And if you can, visit the website to enroll on it, and that's the www.regeonline.com/blocknursecourse. And that is where you can go to get more information about the dates that the course is being offered, as well as register your nurses there.